Hello, my name is Logan Luzader. I'm a student here at ETSU, and this is my video on movements and muscles of the thigh. So, in this picture from MenMeShop.com, we have a flexion and extension, and the flexion of a thigh would bring the thigh up towards your abdomen, and extension of the thigh would bring it back towards your posterior side. The easiest way to memorize flexion and extension is by thinking of flexion as decreasing the angle and extension as in making the angle larger. And then we also have abduction and adduction of the thigh. And the best way to think of that is if you adduct, you're adding the body part towards midline. Abduct, you're away from midline. So that's how I memorize it is adduct, you're adding the limb towards you. Abducting, you're removing the limb away from you. And then the muscles of the anterior thigh, we have this from teachmeanatomy.com. You have the vastus, which means tensor, and vastus are all on these front. And you have vastus medialis, which is on the medial side of your leg. You have vastus lateralis, which is here in the blue. It's on the lateral side of your leg. You have rectus femoris going up along here. And easiest way I remember rectus femoris is to think of it as following along the femur. That gives you the femoris part, and then the rectus goes, it spans across the entire femur pretty much, and that's how you can easiest remember the rectus femoris. Underneath the rectus femoris, you can't see it, but you have the vastus intermedialis, that is between the lateralis and medialis. The intermedialis is very simple. It's in between the medialis and lateralis. And then the next we have going across is the sartorius. This is often referred to as the tailor's muscle because traditionally that is how Taylor sat while sewing. Therefore, when you sit cross-legged like crisscross applesauce, that is the muscle that is being used. On the posterior side of the thigh, you have three main muscles called the hamstrings. You have the biceps femoris, and then you have the semimembranosus, and on top of the semimembranosus, you have the semitendinosus. The easiest way to get, because these two can be quite confusing, the membranosus and tendinosus, easiest way to remember it is that M in membranosus comes before in the alphabet, before T in tendinosus. So membranosus is going to be below tendinosus because M comes before T in the alphabet. That's how I memorize them. You also have the biceps femoris, which is you have two heads, a long and short head. This picture only depicts the long head. But the easiest way to remember the biceps femoris is, again, remember that it's going along the femur. And then you also have biceps, meaning two heads. So you have two heads, a long and short head. Next, we have the adductors. You have four main adductors of the thigh. You have the pectineus. Right here is a very small triangle one, the adductor brevis. You have the adductor longus, and then the adductor magnus. Now these ones are ones you have to sort of memorize, especially pectineus. Is really not a good way that I found to memorize it. But the brevis, longus, and magnus is, again, similar if you think back to the alphabet. You have brevis, and then longus and magnus. If you go down from the hip to the ankle, or hip to the knee, if you want to refer to it that way, you have the brevis, because the B comes before L in the alphabet. L comes before M in the alphabet as well. So if you just go down the alphabet, you have brevis, longus, and magnus. You have brevis, longus, and magnus. Pectineus, that's just one you're going to have to kind of memorize. I haven't really found a solid way to memorize the pectineus. And then last, we have the abductors of the thigh. These are kind of loosely termed because you have the gluteus muscles, which is your butt muscles. Gluteus maximus is on top of the medius and minimus, which you can't see the minimus in this picture. But the gluteus maximus actually goes across and attaches right here in the medial femur. Uh, it helps with abduction of the thigh, pulling away from midline. And you have medius and minimus also with some help as well. And then also the long muscle right here, we have the tensor fascia lata along that crosses this entire thing, and then it connects into your medial side of the medial or lateral epicondyle, excuse me. And those are the abductors of the thigh.